Welcome to the Columbus Metropolitan Club. I'm Kelly Atkinson, the Diversity, Equity, and Inclusion Director and Columbus Office Administrator for Barnes & Thornburg, and I'm also the Chair of the CMC Board of Trustees. Thank you to the presenters of CMC's ongoing Optimal Health Series, the Ohio State University Wexner Medical Center, and Nationwide Children's Hospital. Today's live stream is presented by the Emergency Response Fund of the Columbus Foundation in partnership with the Columbus Dispatch. Let's thank all of those supporting today's forum. Good health really is about so much more than medicine. Even communities with the latest in medical technology may struggle to improve the overall health of their nearby populations. That's because other factors are at work in determining healthcare outcomes. We'll unpack these social determinants of health with today's speakers. Please welcome Perry Gregory, Senior Vice President for the National Center for Urban Solutions, Amy Headings, Director of Research and Nutrition for the Mid-Ohio Food Collective, Mike Premo, Director of Engagement with Community Development for All People, Jesse Reed, Director of CareSource-Life Services Ohio, and our host, Greg Moody, Director of the Professional Development and State of Ohio Leadership Institute at The Ohio State University's John Glenn College of Public Affairs. You can learn more about all of these speakers in your forum flyer. But Greg, we really look forward to today's conversation.
Thank you, Kelly, and welcome to our panelists. Our health is affected by where we live, learn, work, and play. Differences across communities result in differences in health, and to improve health, we need to understand what causes those differences. Access to clinical care is important, critically important if you're sick, but mostly your health is determined before you see a doctor by your environment, health behaviors, and social and economic conditions. Take, for example, life expectancy. 1 mile north of here in Grandview, you can expect to live to almost 85. But 1 mile south in Franklinton, life expectancy is 60 years. That's a quarter-century difference in less than 2 miles. And from Franklin Park to Bexley, there's an 18-year gap in less than 1 mile. So upstream differences in social and economic conditions across communities flow downstream as differences in health status and life expectancy. Our panelists are doing important work through community-based organizations to address social and economic determinants of health, linking individuals to safe housing, reliable transportation, nutritious food, good jobs, all of which improves health outcomes and avoids the hardship of unnecessary medical encounters. Health happens in communities. And I'm so pleased to start this conversation about what we can do to achieve better health for everyone. So, panelists, please start by reintroducing yourselves, your organizations, and from our conversation over here, you are each incredibly passionate about what you do. Maybe share a little bit about what it is in your work that brings out that passion.
You want me to go first? All right. COVID's over and we got people in the rooms. That's good. But I am Perry Gregory, Senior Vice President for the National Center for Urban Solutions. And NCUS is a community-based organization that's been around for over 30 years, helping improve conditions in the urban community through education, workforce, and health and wellness. So you may be familiar with the African American Male Wellness Agency, which our founder started 18 years ago. We run what we call dropout recovery high schools across Ohio, called the Academy for Urban Scholars, and then NCUS. We've been around helping improve conditions in workforce, working with customized employers such as J.P. Morgan Chase, Cover My Meds, Jobs and Family Service. For over 30 years, we put about 25,000 individuals back into the workforce. But for me, I'm really passionate about this work because I think that it's such an important that all individuals have access to living a better quality of life, whether it's having a good job, whether that's having good health, or whether it's having more access to higher educational means. So we live it, we walk it, and this is my life.
Hi, everybody. Thank you for having us today. My name is Amy Headings. I'm from Mid-Ohio Food Collective. And Mid-Ohio Food Collective, some of you may know us by the former name of Mid-Ohio Food Bank. And so we rebranded in 2020 to really reflect more of the work that we're doing and how we get food out to people in multiple ways. And so really, the food bank is still kind of the core of what we do with food distribution, but we also have several other assets, including our Mid-Ohio Farm in the Hilltop, Mid-Ohio Kitchens, which also does food distribution and some of our after-school programs. And then we have our Mid-Ohio Markets, which we have several of those around Columbus that are really helping to move the needle on food distribution in our communities. And then we have the Mid-Ohio Pharmacy Program, which is what I primarily work with, and it's our link with our healthcare providers and others throughout the community that are providing healthcare. And so, like for me, what makes me passionate about the work is that I'm a registered dietitian, and one of the things I think that is really important is sometimes, in my training as a dietitian, food access was really something that I thought was a given, but it isn't necessarily a given for everyone. And really, before you can actually improve your health by changing the way that you eat, you actually have to have access to the food that you need in order to make those changes. And so I've been at Mid-Ohio Food Collective for about 10 years now, and so really helping to link the individuals that have chronic disease to the foods that are needed in order to make those changes is really kind of what drives me in this work.
Good afternoon, everyone. My name is Mike Premo, and I'm the Director of Engagement for Community Development for All People. We are a location based on the south side of Columbus. We are a community development corporation that works to transform the south side into a sustainable mixed income community where everyone can live and thrive. We have two different things that we do. We do direct service. We do direct service programs to help people who are low income, but we also do community transformation work to help lift people out of poverty and help them address systemic barriers that prevent success. So over the years, we started in 1999 with the United Methodist Free Store, which was just a place where people donated their clothes and household items and folks could come and shop for it for free. That launched the United Methodist Church for All People in 2001, and then the Community Development Corporation was founded in 2003. We are completely owned by the United Methodist Church for All People. We're unashamedly faith-based, but our programs are welcome to everyone. Like it says in the name, we give our love to everyone, no matter who they are or what they have done, and we welcome all people. So, in addition to the Free Store, which sees about 20,000 people a year, about $2.5 million of merchandise is given away. If we were to sell it, it'd be about $2.5 million. We've done $125 million in affordable housing by ourselves and with our partners like Nationwide Children's and our collaborative Healthy Homes Initiative. We're on track to do another $45 million this year alone on the South Side. We have what's called our Healthy Eating and Living program, which helps people live healthier lives. The biggest expression of that is the All People's Fresh Market, which we collaborate with Mid-Ohio to get the food for. We see about 30,000 people a year there. It's one of the largest points of free food distribution in the state of Ohio. And we offer wraparound classes, nutrition, cooking classes, smoking cessation, yoga, Tai Chi. So if you're looking for a good Tai Chi, Thursday mornings on the South Side is where you want to be. We have Thrive to Five, which works with pregnant moms and new parents to make sure their kids are born healthy, thrive to age 1, and then enter kindergarten ready to learn. And then we have our youth development program, which works with after-school kids in 2 Southside elementary schools during the school year. And in the summer, we run what's called a Children's Defense Fund Freedom School, where we take in about 80 scholars over the course of the summer, about a 6-week, 5-day-a-week program, full day, where we work on their literacy skills, but also teaching them that they can be an agent for change in their lives and the lives of their community. So we have all of those things. In addition, we have a couple of social enterprises which we've opened up over the years. The latest one coming up on the south end of Parsons is the South End Cafe. I don't know where you're getting your coffee now, but it's going to change pretty soon. So keep an eye out for the South End Cafe opening at the end of June. And so part of what I have worked in a lot of places all over the country. I say to people, I've been looking for community development for all people my whole life. I just didn't know it, because it is a place that understands that the most important thing that we can do is build relationships, what we call relationships of mutuality. I'm not always helping you, or you're not always helping me. We're coming alongside each other and going through life and helping us that way. It's a beautiful expression of community, and it really is the way that we've been able to transform the South Side. So I'm very excited to be here today. Talking about my job is my favorite part of my job, so today's a good day.
Awesome. Hello, everyone. Jesse Reed. I'm the director of our life services program at CareSource. I'm going to start with what drew me to the work, and I'm going to bring it back around to actually what we do. So as far back as I can remember when I was a kid, and when people would ask, what do you want to do with your life? What do you want to do? What do you want to do? It was always, I want to help people. Help. It was just a word in my mind at the time as a kid. And so grew up, went to college, became an adult. The first half of my career was kind of spent working directly with folks with disabilities actually, working in their home, working in the schools, writing behavior plans, all that fun stuff. And then that kind of brought me to CareSource, which is my job today. Started CareSource 7 years ago today, actually, I realized on the way in today. So 7 years ago, we launched this pilot called Life Services. And so I was the first employee brought on board with Life Services. And Life Services is kind of the CareSource word for the social determinants of health, which is exactly what we're talking about today. 7 years ago, it was kind of a buzzword, but now it's the wave in healthcare, and rightfully so. When a lot of people think of healthcare and CareSource and managed care providers and payers, you think of things like claims and all the boring stuff and connecting people to a doctor. We in Life Services, kind of what we do with our members and with our wonderful community partners, is we focus on all those wonderful things that go on in our members' lives outside of the doctor's office. Things like housing and food insecurity and finding a job and keeping a job and social isolation and being connected into your community. So that's kind of what we do all day, every day with my wonderful team. So we'll talk a little more about that as the program goes on, but that's kind of me and what I do, and I'm glad to be here. So thank y'all.
All right, thank you.
Doug, I told you I wanted to go last because they were going to come with these good introductions.
Well, we're going to hear from you now again in a second, so, but we can shake it up and anybody can jump in. So you all have this intuitive instinct, I think, for how your work directly contributes to health, whether it's housing or nutrition or job training. But maybe elaborate on that. Pick a project or something specific you've done where it was crystal clear to you that whatever that intervention was, whatever the social support was, how it was directly translating in better health outcomes for the community. And anyone who wants to jump in first.
I'll tackle that first. Yeah. For me, much of my daily work lies in workforce. And so I'm going to talk about it from two different ways, workforce, and then I'll hit it on the health and wellness side of what we're doing. But particularly at workforce, the impact of COVID-19 had a big impact, particularly with low-income communities. And so for me right now, much of our work that we are doing, not only here in Central Ohio, but across the state of Ohio, is making sure that underrepresented populations are skilled up and retooled for this new economy that is currently happening right now across Ohio. You see Intel coming to Ohio, and that's a big thing. But we also have to make sure that our community members, that they have the proper skills to be able to do these high in-demand jobs that are coming to Ohio. And so through a number of projects, we're working with the Governor's Office of Workforce Transformation. We lead an industry sector partnership that is in IT, where we are focusing on closing the gap with underrepresented group, from K-12 all the way up into adults. And so at the K-12 level, we're making sure that students are informed and engaged in computer science learning. When we look at high schools, we're making sure that, going around Ohio and speaking to high schools and, making sure that individuals, high school students are participating in-demand certification programs, whether it be software developers or data analytics. And then with the adult population, making sure that, individuals who quit their jobs during COVID, that they're coming back and being retooled in new industries, whether it be manufacturing or IT. So we're training software developers. And what we've seen is that, there's a big word across the community that people didn't want to do it, but it's actually reverse, and that people do want to do these jobs. But I think it's important for the community to know is that, as Central Ohio makes this transition, if we don't get people properly skilled up, you can look at cities like Seattle, where tech became one of the main industries. They saw homelessness go up. You saw more people out of work. And so it's important for us to make sure that, we are tackling that issue. And then on the health and wellness side, the projects through the African American Male Wellness Agency, currently we have a number of different health equity projects that we're doing. We're working with the American Diabetes Association and Abbott, to where we're making sure that individuals who have diabetes, that they have access to technology through their glucose monitoring system. Our community, when we think about a glucose monitoring system, it's just something that's not been heard of. And so, by coordinating with Abbott and the American Diabetes Association, we've been able to give them new ways of engagement to go about and engage African American men and senior groups who aren't familiar with these new technologies.
Yeah, one of the things for me and for the Food Collective really is, first of all, I just want to really acknowledge that none of this work gets done really in a vacuum or by yourselves. And so we have many great partners that help move the work on health equity. And so just really kind of one specific example is our Mid-Ohio pharmacy strategy, as well as our Mid-Ohio market strategy, and how those two things really come together. Several years ago, I'll talk about the Mid-Ohio markets first. Several years ago, we did some interviews with community members, a lot of interviews with community members that were using our food pantries to really learn what are the things that are needed to make food access easier. And what are some of the challenges that are facing? And really, the Mid-Ohio markets are a birth of the responses from our community members. And what they were telling us is that we need more access, we need more hours. And so the Mid-Ohio markets, and we have several of them throughout Columbus. There's one on the east side in Reynoldsburg. There's one at Columbus State. There's one on the near west side, and then one that's going to soon open in the far west side. And really it's a model where individuals can come shop at a grocery store type model where they can have access to fresh foods on a really regular basis. And so that's really one of the ways that we are able to promote health equity, is to give that access to people for the foods they need and when they need it and where they need it. But in addition to that, the Mid-Ohio Pharmacy Program is a partnership with our healthcare providers to help to, food insecurity is sometimes not one of those things necessarily that always comes up in conversation when you visit a practitioner. And so it's really a direct effort to start to screen individuals for food insecurity while they're visiting their provider. And then if that comes up, then what are the solutions for that? What are the resources that we can help connect to that person? And so for our healthcare partners, we're really thankful for the work that they're doing as well to help promote that health equity in screening patients, getting them a referral to us, and then for us connecting them to our markets or one of many other places too, like CD4AP. They're a great outlet and one of our partners in the Mid-Ohio Pharmacy Program as well.
So I want to talk about a couple of things. I mean, the market is probably a very obvious example that, thanks to our partnership with Mid-Ohio Food Collective, we encourage people to come back and shop as often as they want. Because we know that the more often they're shopping with us, they're eating healthier, which means they're going to have better health outcomes. So that's a great example. But I want to talk for a second about a couple that are kind of off the beaten path and that I didn't mention before. And the first one is, to back up, I try to, whenever I get a chance to talk with people, to emphasize the fact that poverty is traumatic. Living in poverty has a negative effect on your physical, your mental, and your spiritual health. And so recognizing that from the get-go, how can we help folks alleviate that negative experience? So, for example, this winter, and we've done it in the past where on the coldest nights of the year, we've opened our doors just to provide a safe place, a safe, warm place for people to sleep at night. We call it the warming center. And we've done it periodically, but this year we noticed something was different, that there was a higher demand than before. So we went to City Council and we asked for some funding so that we were able to open the warming center 7 nights a week for 5 weeks during the coldest part of the year. And we went from seeing 20, 25 people a night to seeing over 100 people a night They came back every night. And even though all we could offer them was a blanket and a yoga mat and, 2 feet of square retail on the floor of our sanctuary, they were coming to us because they felt safe. They were able, the biggest blessing we had was when you would stand there in the dark and you would hear people snoring, because it meant that they felt safe enough they could let their guard down enough to actually get a decent night's sleep. That's a huge start to your day, is getting a decent night's sleep and a healthy meal, which was provided by Mid-Ohio. They brought us these microwavable ready trays, and every week I kept going back to them and saying, I know we said 80, but can we get 90 a day now? I know we said 90, but can we get 100? And they always said yes, so a huge credit to them for that. The other one is that we determined early on in the pandemic that we wanted to do everything we could to get folks vaccinated. It's not something you would think of as something we would do, but we really wanted our community to be protected, to have their health protected. So we partnered early on with Columbus Public Health. We were one of the first community-based vaccine clinics in the city, and then later with OSU's Wexner Medical Center. The Wexner Medical Center community care coach is on our property every Thursday. Originally, it was just to provide vaccination shots for folks, but now it's to provide primary care services. And as a matter of fact, it's so popular, I went to get my vaccine booster, I couldn't get in. So it was a great sign of how well it's been adopted by the community. But working with the community and highlighting stories of folks who got vaccinated, taking stories on social media and highlighting them to address the overwhelming misinformation that was out there and fear and concern. A woman named Beverly, I sat and held her hand while she got a shot, and she cried. And she cried, and when it was over, she was like, wait, that was it? But she had built this up in her mind that it was going to be so scary to get that shot, but she finally was willing to do it, and then she told her story, and it helped get other people. So it's just part of the beauty of community development for all people is we're always thinking of new ways to engage with the community, to improve the social determinants of health, and it's just a beautiful, and our partnerships are with CareSource and with Mid-Ohio and with OSU Wexner and Children's Hospital and so many more. If I listed them all, we'd be here all day. It's just been a beautiful expression of people coming together to improve the social determinants of health.
Yeah, so there's a lot of different directions I want to go here, but I think I'm going to piggyback kind of off what Perry talked about with workforce development, because it's kind of what brought us to have a life services department in the first place. So at CareSource, we survey our members a lot. Again, we call our people our members. We survey our members a lot, and when we surveyed them in 2014, one of the big themes from that year kind of surprised us as a company. It's usually things like, we need help with the provider network, help me connect to a physician here or a specialist up in this part of the state. But the theme on that particular quarter in 2014 was, CareSource, we love you, but here's a news flash, I don't want to be a Medicaid member all my life. Help me get up and off of Medicaid and up and off of CareSource. And so we took that as a company and kind of said, okay, what do we want to do about this? At the same time in Dayton, back in 2014, I'm a Dayton guy, so if you guys know about Dayton, a big glass manufacturer called Fuyao was moving into town at an old GM plant, and Fuyao was looking to hire 2,000 people. So it was this confluence of things where we had the members telling us, help me get a job and work my way up and off of poverty, and we had a big employer coming into town saying, help me find people to work at this factory. And so that's when we launched Life Services. And our workforce development spoke of Life Services is we call Job Connect, and our Job Connect program hinges on our life coach model. So we have a team of life coaches across the state working with our members, and we call them life coaches for a reason. We hire social workers, we hire folks with care management backgrounds, case management backgrounds, but then we train them and certify them to be an actual life coach. Some of you in this room may be working with a life coach. It's a true life coach approach, and it's a model that low-income people haven't always been approached with historically. It's our folks come to us, and the first thing we tell them is, you're not broken. We're not looking to fix you because you're not broken. You've got a lot of strengths. You've got a lot of things you want to do. And what do you see yourself doing in a year, in 2 years, in 5 years? If you're homeless and you want to be an astronaut, all right, let's step that goal out. And what does that mean? And as Mike called out, there's so many wonderful kind of community partners in the community already doing all these great work. Our role at CareSource is not to kind of do the work itself. It's to plug our folks and to be that kind of social determinant quarterback, to plug our members into the resources that already exist in their community. So that's what we do generally in life services, but it hits on all. We have members who have workforce development goals. They're either unemployed and they might have a felony background, or they might have fallen on hard times, and they might be working 3 part-time jobs, but they want to get into that one career field. So we have over 200 partner employers throughout the state that we can kind of be that professional reference for those folks with. We have folks with just housing goals. We have folks with food insecurity goals. It really runs the gamut. So that's kind of what we do in a nutshell with life services, and it really touches on all the social determinants. So I'm really excited for these next kind of prompts to come. So, yeah.
Thank you. You each are working to fill gaps, largely. Gaps that, when you're able to fill the gap, you can directly impact health outcomes. In a word or two, maybe say what is behind what's creating those gaps. What are the root cause of what it is that then you're having to intervene to correct?
I'd love to jump in there if I could.
Yeah, please
So
do.
it strikes me that we're at a networking event, and you'll hear me talk a lot about relationships. I think relationships are so important, and they're even spotlighted with low-income individuals. Many of us in the room, I can think back to myself, you go through high school, you might go to college, but it's networking. You got to meet people in the industry, and you got to connect with folks. And a lot of our folks that we work with, it's just a lack of connections, and it's a lack of relationships with folks in their community. And it could be, one connection to the right employer or to the right community agency. It literally might change the course of someone's life. We see it every day. So our life coach, I'm really proud of that role. You hear me talk about it a lot. I spent my first year at CareSource as a life coach. So it was this magical year of really getting to know our members and see them in person, face to face, and really experience firsthand kind of what they go through. So in my experience, at least, it's a lack of resources, it's a lack of kind of connections, and it's a lack of kind of knowing how to network, I guess. So, yeah.
Yeah, I'll jump on the, because you hit it right on the money, but the first one for us is always awareness. Through the variety of projects that we do and the work that we do, our number one message is we got to get the message to the people and go and reach people where they're at. And so, whether it's health and wellness, particularly in the work that we've been doing with black men don't go to the doctor. And so we've had to change up our messaging so that we can get them excited about going to the doctor. And so, that's why we have a health walk. Well, we're not just out there walking. When we have our health walk, we're doing the walk so that we can get, over 1,000 men screened on that day. And so that's created a lot of synergy. When you think about workforce, I tell employers all the time, employers will say, well, we can't find talent. And I'll say, well, you just haven't went to where the community is. And so that grassroots messaging is the most important for me is, how do you go and meet the people where they're at? How do you change the message? And how do you customize the message so people can understand it? We're doing a project right now with our great partners over at CareSource to where we're doing a vaccine project and we're going door to doors. So over the last 6 weeks, and they will tell you that we've went to 20,000 households, but we deployed a grassroots outreach team and just going and get people vaccinated. So we've been able to get like over 300 people vaccinated by just knocking on their doors. And what we found is a lot of people are getting vaccinated. And then the other thing will just be lack of resources, particularly in the African-American community. For far too long, there's been a lack of resources, whether it be from, treatment centers that are in there, whether it be from investment. And so I think that, just moving forward is so important is that we make sure that low-income communities have the proper resources. And it's not just about money, but it's also about connections and partnerships.
Yeah, and for the food bank, for the food collective, really, when you think about food access, people are having to, and especially as it relates to health, people are having to make a lot of choices when it comes to, do I pay for my rent? Do I pay for, something that my child needs? Or do I spend the money on food that is going to improve my health? And so a lot of the times, food that would be healthful, it gets the short end of the stick. And so that's one of the reasons, why we have our market strategy is to put food in the communities that is free to the people that are accessing them.
Yeah, and just to touch on something that Jesse said, what we call it is the accompaniment model, walking alongside someone as they're helping them achieve their hopes, dreams, and aspirations. And what we know is that along the way, folks encounter any number of systemic barriers that prevent them from moving forward. And if they don't if they don't have the resources, if they don't have the understanding, they just throw up their hands and they give up. I'll give you a perfect example of this. We started a small program called ID for All People, which was helping people to get their birth certificates and state ID cards. We've helped over 800 people, or 800 applications processed to help people get theirs. And a lot of times, it's not as simple as you have to just go down to the BMV, which we give people bus passes to get down to the BMV. We give them a voucher, but they've got to pull together the right documentation. If they don't have the right documentation, they get turned away. So it's helping them understand what they have to bring with them in order to get their ID. Birth certificates is another issue. If they're in state, it's fine, we can help them, but if it's out of state, 50 different states, 50 different systems for requesting birth certificates, and you can't even get your ID until you get your birth certificate. So we have people that we've been working with, in some cases literally 6 months, 8 months, a year, trying to get them their out-of-state license or their out-of-state birth certificate. And if they were to try it by themselves, they would have given up a long time ago, but we're constantly walking alongside of them saying, it's okay, we can do this, we can get this taken care of. Did you know, for example, that there's a lifetime limit on the number of replacement Social Security cards you can get? It's 10. We found that out. People living in poverty, especially people experiencing homelessness, lose their ID all the time. And we had a guy that we're working with who had hit his lifetime limit. So the question then becomes, well, what now? If he doesn't have his Social Security card, he can't get his driver's license or his state ID. So what do we do? So these systemic barriers pop up all the time. And a lot of times, sometimes all we can do is make them feel like we care. We're not going to be able to solve their problem, but we're willing to try to help. And when they run into a barrier, we're going to encourage them to stay on. But we're just going to let them know that somebody cares enough to spend time with them and try to help them overcome that systemic barrier.
Well, and in the communities I described earlier with life expectancy, when you go all the way upstream, the real correlation is always to disparities in income and wealth, educational attainment, and systems that perpetuate racism. At some point, that's the upstream that as a community we need to address. So then in that midstream where you're providing housing and nutrition, and it's easier to get at some of those issues. So several of you mentioned resources. So how do we pay for the activities you're describing that keep people well? And if they're keeping people well, my question is, what about health insurance? Does health insurance pay for these kinds of activities? And Jesse, not to put you on the spot,
Yeah.
but you're with a health plan.
Yes.
So let's,
You teed me up.
Let's start with you.
Yeah, so CareSource, so our life services program, free is not the right word, but free is the word I'm going to use in this room. It's free to our CareSource members. And not only that, if your child's a CareSource member and you might be a working parent and not on CareSource yourself, you can access life services and work with the life coach. So it's something we're real proud of. It's a benefit that we cover. And not only that, something I always like to highlight is if you are a CareSource member and you start working with a life coach today, you might go through the process and find you a job and get up and off of Medicaid like I referenced. You can still work with your life coach for up to 2 years after you kind of have met that goal, because our goal is not just great, you found a job, it's shake your hand, it's happily ever after. We're really looking at that sustainability piece. You found a job, great. Are you keeping a job? Are you meeting that next goal? Are you moving into a better house or a better apartment, or you're buying a house or buying a car? So we're really focused on that sustainability piece. But yes, at CareSource, life services is a benefit for our members.
I can speak
You
next.
got it. It's on
Yeah, right? I have to say that at the Food Collective, we're super blessed in the community to be supported and well supported by many donors. And for the food and health partnerships, we're also supported too by many of our managed care organizations. Many of our healthcare providers also work to support the work. And so, but there's room for improvement, definitely. And so there's really no organized way that it's supported at this point in time. And so, and as we move forward, you know, one of the things that we hope to do really is to start working to see how can we make this really a more sustainable model as we work to address the social determinants.
So we have a saying, we believe, sorry, let me back up. We're owned by, it's a United Methodist Church. We're unabashedly faith-based. We joke that we are bilingual. We speak spiritual and secular. So I'm going to get spiritual for you for a brief second, so bear with me. But we believe in what's called the divine economy of abundance. God made everything. God made it abundant. So we know if we do the work, the resources will present themselves. So just like our wonderful partnerships where we are able to provide services to folks, we know that when we do the work, funders present themselves, and I could go on for hours about all the different ways in which our resources come pouring in the door. The free store is probably the best example. We have never run out. In 20 years, we've never run out of anything. Anytime we're running low, that back doorbell will ring and somebody will donate it in record time. So that's just one example. So the divine economy of abundance means the resources are there. We just have to do the work. And the folks here and a lot of folks in this room are doing the work. And I think on the city level, our city government is doing the work. On the county level is doing the work. State level could be doing a lot more. And the federal level could be doing a lot more too. We've seen it recently with the American Rescue Plan and that. But the investment, the resources are there. It's just the political will to invest them in ways that can actually transform people's lives. It's not a mystery how we can lift people out of poverty. The child tax credit is a perfect example of that. That was giving direct aid to families every single month. And lo and behold, millions of families were lifted out of poverty. And then the political will ran out and it stopped, and these families are starting to sink back into poverty. So we tell people all the time, we're doing our part. On the south side, we're doing our part. You folks have to step up as well. So the message is getting kind of lost a little higher up the food chain you go.
Yeah, I think that I always tell people I think COVID-19 was a gift and a curse. I mean, because what you saw was a lot of corporations actually step up to invest into low-income communities, but I don't think it's enough. And I think it has to be really intentional about working with organizations who are oftentimes doing the work. And I know particularly minority organizations, oftentimes we are shorted funding opportunities to really be able to provide resources to the people that we serve. You know, I work with a number of smaller nonprofits, and, you know, they are coming into our office and, you know, trying to figure out ways that they can build capacity. But I think it's more so on the corporations to keep investing, you know, if it's workforce. You know, I tell employers all the time, you want talent, you need to invest in talent. You know, my team is not out here going to find you talent at no cost. And so you want the best talent, you got to invest in the best talent.
Well, and what are kind of one-time requests for funding versus ongoing revenue streams? And for me, one of the high points professionally was to be a part of the team that expanded Ohio's Medicaid program. And currently about a little over 3 million Ohioans are on the program. And through that, recognizing this connection that health is not always clinical medicine, but also the supports, and that it's legitimate to essentially buy health by paying for those supports. So where are those regular streams that we can perpetuate? Okay, I'm going to shift a little bit. We're going to move to questions from our live stream and in-person audiences in just a few minutes. If you have a question, please make your way over to this microphone now. If you're watching online, please type your questions into the chat. But before we take audience questions, I have one final question for the panelists. So you're already deeply engaged in partnerships. We were talking about funding. In the audience, you have leaders from our community. What is it that as leaders and participants of this community we can do to be able to connect to your activities and support what you do?
I'll jump in because I'm the fundraiser for CD4AP, so I'm going to take this opportunity any chance I get. First of all, we're always looking for volunteers. It is a great experience. I hear stories all the time from folks who come in for the first time, and they are transformed by volunteering with us. But also, we're always looking for donations as well. And I think I speak for every single nonprofit in the entire universe when I say unrestricted funds. Please, folks, let us decide the best way to spend the money as opposed to allocating it to a program or other. I know there are people who have certain passions and that's where they want the money to go, but we are always talking to folks about there are overhead costs that we have to incur, salaries, benefits, things like that. They're not sexy, you can't do a fundraiser for them, but they really help make the organization run. So if you want to make a donation, you go to the number forallpeople.org/give and make your tax-deductible donation today. Thank you.
Yeah, and I'm going to jump right on that too.
This answer is heading.
I'm going to build off of that, and just, you know, Mid-Ohio Food Collective, our work is, you know, not free either. And so we are well supported by the community, and we're really grateful for it. And But yes, if you want to donate, you can go to our website and do that as well. And also volunteers. We have great volunteer opportunities across the greater Columbus area as well as greater Central Ohio area. And so you can learn about those opportunities on our website, Volunteer Hub. But then really for just really the social determinant of health work as a whole, the work is not easy. I mean, by any stretch of the imagination. And I think that, for me, it's really just staying to it and figuring out how to work together, no matter really how hard it is. I mean, there are some major hurdles along the way that you have to get through. But if you keep the end user in mind, that's really what I try and think of. Is like, I talked to, even just on the phone yesterday, a patient called me and she had some significant dietary restrictions. And, for me, I'm pretty busy during the day, but I was just gonna take some time with her. I went down to the pantry to figure out, with our pantry manager, okay, this is what she has restricted in her diet. How can we help her connect with food that's meaningful for her, that's gonna help her improve her health? Called her back, got her connected to some different resources. And so I think just really having that will to work together, no matter really what the cost, and keeping the end user in mind, that people are really affected every day by the work that we do.
I brought my finance guy. If you wanted to invest in us, he's sitting right there. No, I just think that just from the community, I think that everyone could do their part. And I think that, if you have connections with a C-suite that may be willing to invest back in some community program, I think that may be your way of doing it. I think it's volunteering. I always tell people, I think the issue that we see right now in most low-income urban communities is that the professionals are disengaged with the community from a variety of ways, from understanding what's happening. I tell people, you want to see what the community, go walk the streets and see it. Go talk to the people. So I think that's important, is that, understanding the issues that are happening in this community. And then I think this D&I conversation, I think everyone in the room is just being very intentional about D&I and really how we close that gap.
What my esteemed panelists said, find a way to volunteer, to donate to the local nonprofits in your community that are actually doing the work, and go get involved. We have a wonderful foundation at CareSource. We have an amazing community marketing team. With our community reinvestment dollars, we try to support the great people that are actually doing the work with our members all day, every day as well. So go put yourselves out there and find the people doing the work, and figure out how you can help. Back to my theme. Yep.
Okay. It's CMC's longstanding tradition to take audience questions. Mantra Moody of CMC is curating questions from today's live stream audience. For our in-house audience, please join Mantra at the microphone. Please keep your questions brief and to the point. Mantra, first question.
All right. Thank you to the panelists for being here. We appreciate you guys being here. All right. Our first question from live stream is from Kathy Fox, and she asks, what would be needed for the state of Ohio to expand CareSource's service area for MyCare Ohio Dual Advantage Plan to the central and southwestern areas of Ohio?
I guess I'll take that one, right? Joan, we'll connect offline. There's a lot of great people. That's certainly way above my pay grade of how we do that sort of thing and the benefit side, but I promise you we'll take that offline and figure out. Find me somewhere and send me an email, whoever asked the question, and we'll make sure we kind of connect you to the right people. So, yeah.
And I would quickly add it, as one of the folks who put together MyCare for Ohio, it's currently covering about 60% of the population who's eligible for Medicare and Medicaid. It is missing other parts. The plan was always to take it statewide. The federal program is changing at the end of this year, and within a year, the state will have to have an answer to that question. So now is the time to advocate for that particular program statewide.
Hi, I'm Jeffrey Feld with Geosite. I first thank you very much. This session's been really helpful. I personally think, if we can address some of the shortcomings in nutrition, both access and in education, that we need fewer drugs, right? Because we can address we can prevent a lot of the chronic diseases, I think, that are directly related to having poor nutrition. And I really applaud our speakers here today. You're really doing God's work. I really appreciate it. So I've heard a lot about addressing access to food. So like the term food desert comes to mind, right? Where you live in a community where, okay, the only food nearby is filled with high fructose corn syrup, right? I can't get good nutrition. And all the groups here are doing a phenomenal job addressing the supply. So I would call the access to be the supply side of the equation. I was wondering, I've heard a little bit about demand for good food, right? So we could supply all the food that we want, but there still has to be a demand for good nutritional food, and that would be, education, like what does good nutrition actually mean, and what do I do with this good food when I have it? So Mike, I know you mentioned something about cooking classes, but I was curious from each organization, how you're addressing the demand side, making sure that people want the good food, that they'll understand that it will make them healthy, and then what do I do with it? So just as from my own personal experience, like I'm very fortunate that I have access to quality food, but I joke a lot. I love cooking, and I love cooking with plant-based products. And I joke with my wife sometimes when I'm cooking. I'm like, we've got enough meals for the three of us, for me, my little girl, and my wife for 4 or 5 days, and it cost me like $12 worth of food here. This giant pot of food I'm making. So I'm just curious how each group is doing the demand side. How we getting folks excited about good food.
Yeah, if I could just start, we do what I mentioned before, which is cooking and nutrition classes, helping people to understand. My favorite story is the first time I think we got avocados in the market, and people were looking at them like they'd just come from outer space. Like, what am I supposed to do with this? And I was the wrong person to ask. I wouldn't know what to do with it either. But showing folks how to prepare meals using these ingredients, and we did a thing right before COVID, and we're getting ready to go back to it, which is basically like, you come to a cooking class, you see how the dish is made, and then we send you home with a bag of all the every single ingredient you need. Even if you need mayonnaise, there's going to be a little jar of mayonnaise. If you need a little thing of dill, there's a little thing of dill in there. So helping people to understand how they can do that, and really accompanying them so that the first time they try it, and I don't know about you, but the first time I try a new recipe, it doesn't always turn out great. And so, encouraging them to keep trying and keep at it, and also giving them that community space where they're talking to each other. It's not just a teacher talking to the class, it's the community talking to each other. And, well, I figured out I could do this, or, my stove is older, so this is how I had to do that. That's the other thing, is there's vast differences in people's equipment. So you have to adjust based on, are you working with a gas stove or an electric stove? Like, is your oven work? Like that kind of thing. If it's not, what do you do? So it's just literally that accompaniment model, but to provide that community engagement where people can talk to each other and see that they're not alone and that they're all figuring out together. It really is a beautiful thing.
Yeah, and I'll just build on that, Mike. One of the things that I just really like to highlight too is our Mid-Ohio kitchen team. They really do some amazing food prep for numerous children throughout Central Ohio, and they make an intentional effort to utilize the produce that we have at the food bank in the preparation of those meals so that our kids are getting access and experiencing new foods that they really might not have experienced in any other time in their life. And so that's just really like one way that we're addressing that and like creating that hunger for good food.
Yeah, we're like this fun group. So we do something called Cooking with Dads. Once a year, we do an event where we bring, like last year we did it at the convention center. We had like 200 fathers, and they brought their children. And they did like a big cook-off. And we partner with HelloFresh, and we have great nutritional food there. And we're teaching fathers how to cook healthy. And then throughout the course of the year, we have something called Fun-Filled Fridays, where we partner with NBC4, and we have a dad and his kid on NBC4 doing some healthy cooking.
Our next question comes from Steve Swift. What's formally being done around Columbus to address peri-traumatic disassociation and peri-traumatic emotional symptoms for all ages living in our deprived and oppressed communities? Other than what is going on at Nationwide Children's, I am not aware of other local programs working to address these issues.
It sounds like, maybe is that mental health question?
I don't know. I'm so sorry.
Some days I'm smart, but it sounds like it to me. And through mental health, we have an initiative that's called Real Men, Real Talk. It's a community engagement initiative. We partner with the the Governor's Office of Faith-Based Commission to where we are really focusing on improving mental health in Black men. So throughout the course of the year, we host forums. You know, we go to churches, we go to barbershops, and we bring mental wellness professionals in to just have safe conversations with men. You know, and what we've seen through that is, you know, have a lot of professional men who are self-disclosing, you know, mental health wellness issues. And you look at COVID, what COVID's done is what we've seen is there's really been a rise in the tick of mental wellness with not just Black men, but with all men. And so that Real Men, Real Talk has been very valuable to really creating a safe space for men to talk.
I just wanted to add real quick. So we have at the corner of our building at Parsons and Whittier, that corner of the building is occupied by Mount Carmel. It's a health station. We give them the space rent-free, and we pay for their utilities to provide primary care for the community. We're now in conversations with them as well as United Methodist Community Health about how we can provide access to mental health resources on our campus to people in the community. So it is a huge issue. It's one that we're in conversations about, and I think that's going to be the next stage of our work.
We have time for one final question.
Pardon?
You're on.
Oh, okay. Well, thank you for the opportunity to be here. I just wanted to say that my dad observed that a skilled technician brought home a good income for his family, a excellent result for the customer, that he didn't have to get a lot of callbacks, and a good income for his employer, and I forgot what else. I was going to stand here too long. But anyway. And we need to put an emphasis on it here, because when this Intel comes in, they're going to pay top salary, and they're going to draw the best technicians out of this whole area. And a lot of companies are not going to be able to compete because we don't have enough people in this area. That's how I end up drawn over here from Indiana. And so we need to take action now, or a lot of companies are going to be hurting or even failing because they can't compete with their salaries. Thank you.
Hit that. The return of manufacturing, he's right. The return of manufacturing is happening right here in Central Ohio and across Ohio. And so I think what you're starting to see is a lot of educational institutions, higher ed, post-secondary providers, really focusing on retooling and reskilling through Industry 4.0, which really focuses on robotics. And so that is like one of the highest topics of conversation in this workforce community, but I think it's happening, and I think that our community is going to be well prepared for these manufacturing occupations that are going to be coming.
If I could just speak to that as well. One of the things at Mid-Ohio that not a lot of people know about is a program called Ready Skill, and Nick Davis is here in our community, and it's also a skilling program that works to take people on that path to build job skills, but at the same time to come around and support with food access and with housing support and with child care support. And so if you really are interested in that or would like more information, I just encourage you to talk with Nick afterwards.
We also do job training. We have what's called the Residences at Career Gateway, which is one of our affordable housing units. It has workforce housing, but on the ground floor it has 2,000 square feet of job training space. And as I mentioned before, the South End Cafe that'll be opening at the end of June, we are going to be working with people who have been out of the workforce for a long time, specifically those who have been incarcerated, giving them job training skills, helping them leverage the part-time job they're going to have with us into a full-time job with another employer down the road, and pairing them with training opportunities through, say, Columbus Works and Goodwill. So we're definitely working on getting our workforce trained up.
Never want to cut things off. One last question.
Thank you. We've been talking about good health, but there's been one thing missing for me, and that is talking about the access to green spaces as a part of good health. And to be honest, while I was listening to you, I was also looking outside. and my issue is that we have great metro parks here, but so many times when I go out to them, I see very few people who look like me. And the Japanese have a term called forest bathing, how being out in nature in the sun can be healing. So talk to us about how we as a community can do a better job of enjoying nature.
Time for one quick response.
So we do it all at Community Development for All People. We actually have a program called Trees for All People, which is working to increase the green canopy on the south side. So we've been going out over the last few weeks and planting trees all over the south side. We're going to continue that program as well. And also working with, we have several community gardens that we manage on the south side so that folks have access to, either they can come and pick produce that has been grown, or they can reserve a plot and grow it themselves, so they can get connected in that way. Also, Schiller Park on the south side is the bomb, and everybody who should go there if you don't already.
All right, thank you. Well, I hope that you all enjoyed today's forum. I know that I learned that all of these things really have a lot to do with how we do things at Metropolitan Club too. So all about relationship building, it's all about like access and like actually awareness and all of these things. So, I mean, I'm just so grateful for all of you and all that you do, and now we all know how we can also take part. So I'm glad that you really addressed that as well, so thank you for that. Please make plans to join us next Wednesday for a conversation on the high stakes of science literacy and education with a panel of experts. Thank you for our Optimal Health Series presenters, The Ohio State University, Wexner Medical Center, and Nationwide Children's Hospital. And thank you to our online virtual seat patrons and to the Emergency Response Fund of the Columbus Foundation for presenting our live stream in partnership with the Columbus Dispatch. And our special appreciation to today's speakers, Perry Gregory, Amy Headings, Mike Premo, Jesse Reed, and our host, Greg Moody. And let's give them all a real big round of applause, they were awesome. Thank you. And also, I want to thank all of you for joining us, because we truly could not do this without you. We look forward to seeing you next Wednesday as the Columbus Metropolitan Club presents another community conversation. Thank you, and enjoy the rest of your day.